Hello, my lovely listeners. I'm Dr. Mary Barson.
And I'm Dr. Lucy Burns. Welcome to this episode of Real Health and Weight Loss. Good morning, lovely listeners. It's Dr. Lucy again, and I'm thrilled to have Megan Pfeffer back with me in the studio for recording this episode. We are recording this in the depths of winter. It is freezing cold in Melbourne, where I'm from, and Megan is also in Victoria and probably just as cold as me. But by the time this comes to air, it may well be warm and sunny where you are, so I hope you're looking forward to a beautiful day. This episode we are discussing, following on from last week's episode on lipoedema, where we talked about what is the condition. This week we're going to give you some absolute pearls on management, so diagnosis and management of lipoedema. Megan, welcome back to the podcast.
Hello, Dr. Lucy. Thank you very much for having me again.
You're welcome, gorgeous girl. You are welcome. So last week we talked about the diagnosis, or bringing awareness to even the idea that there is this condition out there that people are unaware of called lipoedema, spelt Lipoedema if you're in Australia, or Lipedema if you're perhaps in Northern America. And it is completely different to lymphedema, which many people have heard of, although the two conditions can coexist. And the triad is probably the lipoedema, lymphedema, and then kind of, what we might call standard obesity.
Yes, that's right.
Yeah. Okie dokie. So one of the things I think that I was just thinking of during the week that I have heard a lot on the forums that we didn't touch upon is bruising in lipoedema tissue. Is that something that you come across a lot?
Yes, easy bruising is another that people will identify with, another symptom that lots of people will identify with. So again, not everyone tends to have that, and it will happen more commonly for some people than others, but it's certainly, there are other symptoms as well, things like cold skin. So skin that's cold to the touch is quite a common one as well. And also we mentioned the kind of the triad of the lipoedema and the obesity and the lymphedema, but we should mention there are quite a lot of other comorbidities that can be together with the condition. So a very common one can be hypermobility. So there's a condition called EDS, or Ehlers-Danlos syndrome, hypermobility. And so that can be something that a lot of women will identify with, whether you've had a lot of dislocated joints in your life, you find it difficult stretching, or your limbs do overextend. That can be another thing that women can identify with. But also type 2 diabetes tends to develop a little later in life for these women. So it's thought that that's not a common occurrence, although for me in clinical experience, I think pre-diabetes and type 2 diabetes is very common. And that, of course, will depend on how far along you are. So it may happen that perhaps because of the gynoid fat distribution as well, that pre-diabetes may start earlier for people who have a larger weight. But for women with lipoedema, that tends to be a little later in life that can come along. Hypothyroidism is a really common comorbidity with lipoedema, so that can be quite common, whether that's Hashimoto's, thyroiditis. So that's, there are quite a few different conditions that can be there, as well as, of course, just metabolic syndrome, which, once that weight gain around the midriff starts and triglycerides rise and if blood sugars are increasing, that can be there as well.
Yeah. And vitamin D deficiency, do you see a lot of that? I mean, where I live, most of Melbourne's vitamin D deficient, but I certainly see it more commonly, generally in people who are perhaps storing excess fat. But what about in lipoedema? Is it more common?
It is, yes, absolutely. Vitamin D deficiency is common. And I think for anyone carrying, as you mentioned, anyone carrying excess fat, the fat cells can sequester vitamin D and doesn't make as much available in the bloodstream. So that's definitely a side effect and something that's really important to look at and manage.
Absolutely. Okie dokie. So if someone has been listening to this and they're thinking, oh God, that's me. I've got this, I've got these saddlebags, as people love to call them, which I just a term I abhor, but anyway, and they're cold and they're bruising and my skin, my thighs are sore and I feel like I've got grainy rice things under them. I had no idea, and what will I do? So what could they do now?
Well, look, I think a terrific place to start really is to see a physical therapist or a lymphedema therapist, an occupational therapist, depending on where you are in the world. that can be a really great place to start, because while they can't officially diagnose you, they are very experienced in dealing with these types of conditions. So they will recognise the condition and can be a big part of the therapeutic, things that you will follow up after that. So they may know doctors who are familiar with lipedema and lymphedema. Of course, you can also go to the Lipoedema Association of Australia Support Society, and that's going to be really helpful with directing you from there. So that's a great place to start as well. And they've got a lot of information you can use. But as far as, I think seeing someone, as far as the health professionals, the physical therapists are the great place to start. And then they can kind of direct you to some other health professionals that may be able to help you. Sometimes it's there are a lot of surgeons around the country who actually will specialise in lipedema and know a lot about that. You can go there for a diagnosis and not necessarily have to follow that through with surgery. There is lymph-sparing liposuction options that a lot of women choose to do to get their legs back to looking normal, that aren't responding to diet. And so that's an option as well. So getting a diagnosis from a doctor is terrific, but you can also see physical therapists to know that this is something that you likely have, so that you can, at least until you find a doctor who's able to diagnose you, at least start using some of the therapies that we know are helpful.
Which again leads us into the next section of what are the therapies that are helpful.
Yeah, so firstly, before getting into nutrition, we talk about complete decongestive therapies. So that's where the physical therapists come into the picture, because they will look at things like manual lymphatic drainage, which is a special form of massage that helps to move some of the fluid. And so depending on what staging you're at on whether you find benefit from that, but a lot of women do find that really helpful. Maybe not so much in stage 1, but from stage 2 onwards can be really beneficial. Obviously, movement is going to be a really big thing, because in the earlier stages of lipedema, your lymphatic system is working, but it's not able to keep up with the fluid overload. So you can get this chronic edema type thing where you are actually getting that accumulation of fluid. So you really need to be moving, because of course it's movements that helps the lymphatics, and muscle movement is what pumps the lymphatic system. We don't have a heart that pumps the cardiovascular system. We need movement, and so that's going to be really helpful, any type of movement. But of course you don't want too much exercise. Over exercising can be problematic. So we look at things like compression garments can be really helpful for returning some of that fluid in the system, and that can help to stop progression of fibrosis. They play a really big part in lipedema management. So, of course, this is where it can really differ to obesity, because you're not needing to wear compression garments with obesity, whereas you really do need to be wearing them with lipedema. And some women, depending on your size, can buy off-the-shelf compression garments. Some will need specialised garments made for them, custom garments actually made for them, depending on whether you have lobules and how symmetrical your limbs are. So they're all parts of it. There are things like vibration plates that women can use that are helpful to stand on, that can really stimulate the body and the lymphatic system. Yeah, so lots of different things like pneumatic pumps, which is like a bodysuit that you can put on, which is a pump that helps, of course, again, with the lymphatic system, can be really beneficial, particularly for advanced and certainly for anyone with lipolymphedema, once they've got the lymphedema component. And then from a nutritional perspective, we really start talking about anti-inflammatory diets is the key place to start. And I think it's important to talk about it outside of just being low carb and keto, because of course that's what I favour, and that's what I use to manage my condition, and I have a lot of success in my clinic with that. But of course not everyone wants to do low carb and keto. So if that's something that you're not wanting to do, then looking into anti-inflammatory diets is going to be helpful. But of course that's a very broad term, isn't it?
Yeah. Just going back to the physical things, so something like swimming or hydrotherapy, would that be helpful?
Yeah, so swimming is often cited as the number one preference for this condition, partly because in a swimming pool, the further down into the pool you go, the more compression that comes with the depth of that. So that can be helpful exercising with that kind of assisted compression. But really, I think, gentle forms of exercise can be nice. Walking, yoga, if you don't have hypermobility issues, that can sometimes be problematic doing yoga, but Pilates for that core strengthening. I think really anything that's going to improve your cardiovascular fitness will be terrific as long as you don't overdo it. And so, of course, working with your medical team and your physical therapists can help with that.
Absolutely. It's interesting. I have a patient, she's probably listening. She gave me this fantastic tip for doing hydro. So she goes to the pool regularly, and she bought it's a coat, a towel coat, and it's got a shell on it. So you actually just put this towel coat on and then you can go home and get dressed, because I think for a lot of people, the idea of going now to, public pools and then having to use the change rooms and all of that creates this barrier. So if we can look at various tools to make things as easy as possible. So she puts on her towel coat, and I now have one, and then you don't get your car seat wet because it's like wearing a giant japara or a giant, coat that's waterproof, but with a towel inside. So you dry and you just put it over your bathers and skedaddle home.
Perfect. I love that. And that really is a thing where you no longer just feel comfortable taking your clothes off in front of other people. And I think a lot of women can identify with that. So that's a great idea.
Yes, absolutely. So anti-inflammatory diets, and this I think is the key to the world. The idea that you can do a keto diet, but it can be not anti-inflammatory. So you can do a inflammatory keto diet, if you like. So I would love you to perhaps chat with us about what an anti-inflammatory diet, like in broad brushstrokes, what does that look like?
Well, I think, again, that's going to depend on who has actually coloured in the picture of that, because there's going to be there are certainly different versions of that for different people. So some anti-inflammatory diets or Mediterranean type diets will still perhaps include grains, as long as they're whole grains. And so that can actually be anti-inflammatory, but it can also be inflammatory for some people. So again, this is really coming down to what we always talk about is bio-individuality. And you can't just really take these broad statements anymore of just saying that, okay, everyone follow this, everyone do this particular thing. So I love the portion of, yes, looking for something that is anti-inflammatory is an important component, but you have to work out what that means for you and your particular body type. So some people may just change to doing a Whole30 diet or any one of these sort of anti-inflammatory type diets. But one of the things I find with women with lipedema is we tend to have problems with carbohydrates. And certainly when you have that carbohydrate intolerance, of course, then that can be problematic depending on the degree that has come to, whether you're pre-diabetic or type 2 diabetic, or perhaps your blood sugars are still okay, but you have this insulin resistance in the background. Then following a food plan that's going to be really high in fruit, for example, because it has lots of lovely colours and the colours can offer anti-inflammatory benefits, I'm not sure if that outweighs what harm the sugar content and the fructose content in those foods do. So that, of course, is what we're really starting to get down into. Okay, how does your body respond to this? And also, where are you starting from? What's your metabolic health like to begin with? Can your body handle these additional carbohydrates? And obviously, eliminating processed foods is going to take away a lot of inflammatory foods and also a lot of simple carbohydrates. So anyone is going to benefit from that type of change. But then I think it does come down to, well, how well, firstly, can your body handle these types of foods? And secondly, how well emotionally can you handle them? So I know that myself and a lot of other people, once I start eating carbohydrates, I find it very difficult to stop. I can't moderate my carbohydrate intake. So if I'm prescribed a diet, it's a little like people who are lactose intolerant. You don't then go and prescribe a diet high in dairy. If you're not handling carbohydrates well, for whatever reason, we don't want to prescribe a diet that's high in them. So I think for me, women with lipedema, regardless of what diet you're trying to find, we know that lowering insulin is important and lowering inflammation is important. So, you can design a diet around those things in mind, which will normally always include, of course, removing the vegetable oils and the highly processed foods. But for some women, it will need to also eliminate the high sugar fruits and the grains that can be problematic, particularly if you have digestive upset, if you've had bariatric surgery, if your digestion isn't well, if your mental health isn't well. Gut health is a big portion of health, and a lot of inflammatory initiators come from how well you're digesting your foods. And so that's going to be, do you have autoimmune conditions? Do you have leaky gut? Do you have dysbiosis or, SIBO or any of those things that then say, okay, well, we do need to tweak this for you. You're going to have to kind of avoid these particular foods that we know are problematic for people with autoimmune conditions or people with arthritis and all of the different things in that. So, so really anti-inflammatory means different things to different people.
Yes. Absolutely. I think probably most people would agree, as you mentioned, that whole foods better than processed foods, vegetable oils. We've done buckets of podcasts on the dangers of, and when we say vegetable oils, they're things like canola, sunflower, or the seed oils. Just no one really calls them that. I don't know why. But yeah, they're highly, not only are the processing the problem, but the amount of omega-6 in it is the problem as well. That's
right. And they're easily oxidized. And rice bran oil is in there as well. I think a lot of people think rice bran oil is the healthier alternative. So I always like to point out that that's not the case. But yeah, those foods are highly problematic. And particularly at the moment, I'm researching that the type of fat that you have alters the signaling of a fat cell. So if you have a fat cell that is already hypersensitive to insulin, for example, and you have a fat that increases that, then that's going to be problematic as well.
Yeah. I think the thing to boil it down to is that for women with lipedema, there are some things that correlate with standard obesity management, but actually no, what we recommend is not standard obesity, because standard obesity is still calorie restriction, which we definitely do not recommend. And calorie restriction is different to calorie deficit, and we've done a podcast on that as well. But calorie restriction, so, when you count 1,200 a day or 800 a day, the 800 fast diet horrifies me, but anyway. So there are some things that people can do that would be the same that both you and I would recommend for our patients that we treat for standard obesity, but then there's extra things that you can do for lipedema to help stop the progression. And I think it's important for people to know that it can be progressive, so we do want to try and diagnose it early and treat and start management early so that we can stop the progression of it. Because I'm sure, as you mentioned, advising people to go and look at the Lipoedema website will be a great start, but it can be pretty confronting.
It can, because yes, you're really looking at pictures of, they show all of the stages. So they're showing, women who can be very advanced. And I think with the message coming through that lipedema is unresponsive to diet and exercise, you can kind of feel like, well, okay, is this my destiny? Is this what I'm heading towards and I'll have no control over? So we really want to encourage the message that left uncontrolled, and remember, a lot of women who are very advanced at the moment have lived through the neglect of knowledge, where they haven't been able to be helped. So they haven't been able to do the things that we now know can be really helpful to stop that progression. And in fact, we see a lot of women reversing the stages that they're at. So we know that is possible. We can't yet sort of say specifically how it changes the lipedema fat. And as we know, fat cells last a very long time. They can be around for a good decade. And so at the moment, we're kind of quite young in the keto, certainly in the keto for lipedema. But in the paper that I co-authored at the end of 2019, which was Ketogenic Diet as a Potential Intervention for Lipedema, we spoke about some key highlights for women, which is that the lipedema fat can be resistant to weight loss diets, but it may respond to ketosis. And also that ketogenic diets modulate pain in lipedema independent of weight loss. And this is a really key thing, because for some women, I've talked to women before who have been about to be put onto morphine patches. Their pain has been so incredibly intense, and they've thought, well, why not give keto a go? They've heard great things about it. And, within weeks and sometimes within days, the pain level will go from an 11 out of 10 to a 1 out of 10. The difference is incredible, and that in itself is life-changing, because it's very hard to be mobile when you're living with such extreme pain. And women with lipedema can have very large legs, which makes it very difficult to be mobile anyway, and a lot of women lose their mobility. So reducing that pain is such an incredible thing in itself. And there was a Norwegian study, a pilot study, that found that they put women on for 6 or 7 weeks on a ketogenic diet and then switched them to a standard Norwegian diet. And the following time, And so the women lost weight and their pain levels reduced. And when they went back to the standard Norwegian diet, they lost all of the pain relief benefits. So, studies like that are really showing, okay, there's something really significant and key here about being in nutritional ketosis. And so that's, other benefits are things like ketogenesis positively impacts lymph vessel integrity and lymph transport. And that's obviously key in women with lipedema and with lymphedema. And it all comes down to, we think, which is the main ketone, beta-hydroxybutyrate, that helps to interrupt the inflammasome pathway, so that NLRP3 inflammasome pathway, they call it. And that just has this knock-on effect for all types of conditions, but it seems to be really beneficial for women with lipedema. And so we will see instances of women, yes, I've been losing weight from the upper part of my body, but I haven't really reduced my pain, or I've reduced it some, because taking away a lot of the inflammatory foods will reduce it some, but perhaps not as effectively as we know that women on a ketogenic diet can do.
It's so fascinating. And in fact, we have Rowena Field coming on the podcast in the next few weeks as well. And she's recently produced a paper, she's a physio, on the nutritional ketosis for chronic pain in all conditions. So, keto is not a dirty word. Like, this is the thing. People go, oh, keto, but there are so many benefits to a well-formulated ketogenic diet. And so I guess it's really about, interestingly, changing our language around, because when you hear diet and exercise, my brain goes to calorie restriction and punishing gym routines. Whereas if we reframed it to nutrition and movement, it's not about the calories in, calories out model. It's about giving your body what it needs, and that will be helpful.
Absolutely. And it's also about down-regulating appetite, because that is a big part of it. When you eat carbs, I know when I eat carbs, I'm starving and I'm ravenous, and I will wake up ravenous. And so you have this appetite that's really hard to satisfy. Whereas with a ketogenic diet, we know that, being in ketosis actually helps to dampen that effect. So you get this kind of natural appetite suppressant. So you can end up lowering your calories, but you're getting enough of nutrient-dense calories there. Your body is also able to tap into your excess fat stores for any additional calories that it needs. But as far as what you're actually eating, that tends to naturally suppress that. So instead of needing to eat 3 meals a day and 2 snacks in between, which is what a typical standard diet will prescribe, and as a nutritionist, that's what we're taught to prescribe. But we know that really elevates insulin, which is the fat storage hormone, and that can be really problematic. So whereas keto, we tend to find that people will start cutting out the snacks. Maybe not in the first couple of weeks. I don't encourage people to necessarily do that straight away, because you just want people to get into ketosis. And if you're experiencing cravings and missing your favourite foods, you don't want to be watching necessarily, restricting what you eat at the same time. So you just enjoy keto foods whenever you need them. But eventually once your body starts metabolizing fat well and you become a good fat burner, your appetite will start to self-regulate. And that's a really empowering feeling, to take back control when you actually feel like eating or when you're hungry to eat, rather than your body controlling you about needing to eat all the time.
Absolutely, absolutely. We call that open. When your woodshed is open, you can access your stored logs, which is our euphemism for our metaphor for fat, and start burning it. But when insulin has locked your woodshed, you can't, and so you're burning kindling or carbs, and you're hungry. And hunger is not a character flaw. It is.
Yes.
It is a biological driver.
And often a reflection on the quality of the foods you're eating. I think the hungrier you are, typically the higher you're having a food of processed foods.
Yes. Yeah, nutrient devoid, and your brain's going, come on, person, get me some nutrients. I really need them. So it just keeps making you hungrier until it's got the required nutrients that it needs.
Yeah, and one of the things we know that's really important with all of this is that we do need to enjoy our food, was what we were talking about before, that it's really important that we do. So this is a way that women can find that they're able to, yes, you have to remove some foods, but often removing those particular foods gives you back control of the other foods. And so, yeah, it is such a self-empowering way to change.
Oh, absolutely. I think processed food steals the joy of real food. So when you've got rid of all the processed food and your taste buds have also woken up again, they're not sort of numbed by, copious amounts of sugar and flour, then you can start to taste proper food again, and it's bloody awesome.
Yes. And I always encourage people to be curious about trying new foods that perhaps they haven't liked for a long time, because their palate will change the more you take away those super sweet foods. Yeah, the more the palate changes.
Absolutely. Well, lovely listeners, how delightful has it been having Megan on the podcast? It has been magnificent. I think she has given us some absolute pearlers of information. Megan, if people wanted to make contact with you, where do they find you?
They can find me at my website, which is called I Choose Health. Yeah, so get in contact there. Feel free to reach out. Anyone that leaves their contact details on the pop-up page on my website, I speak with, and we can have a chat. And if I can help to direct you in any way, I'd be more than happy to. But also do reach out to the Lipoedema Association of Australia.
And in fact, Megan and I are both attending the conference. Well, Megan's speaking at it, and I'm going along to soak up all the wealth of information I can so that I can have more understanding of this condition, because it is, as Megan's mentioned, completely underdiagnosed and much more prevalent than even I realised. Wonderful, lovely listeners. We will catch you next time. Have a beautiful week. Bye for now. So, my lovely listeners, that ends this episode of Real Health and Weight Loss. I'm Dr. Lucy Burns.
And I'm Dr. Mary Barson. We're from Real Life Medicine. To contact us, please visit rlmedicine.com.
And until next time, thanks for listening. The information shared on the Real Health and Weight Loss podcast, including show notes and links, provides general information only. It is not a substitute, nor is it intended to provide individualised medical advice, diagnosis, or treatment, nor can it be construed as such. Please consult your doctor for any medical concerns.